Welcome back to Cycle Wisdom, where we empower women to restore natural menstrual cycles to improve health and promote fertility. I'm your host, Dr. Monica Minjeur, and I am so glad you're listening today. On today's episode, we're going to be talking about some of the other important hormones that play a role when it comes to looking at your menstrual cycle. Now, certainly there are so many hormones that play a role with your cycles and fertility since they all interact with each other. But the ones we're going to focus on today include cortisol, prolactin, luteinizing hormone or LH, follicle-stimulating hormone or FSH, and anti-Mullerian hormone or AMH. We will talk about each of these hormones as far as what they do, but I really want you to understand that they all work in concert with each other and are part of a more complete evaluation when it comes time to figuring out what's going on with your menstrual cycles as well as your fertility. So as always, let's start off today with a story about a past client of mine who we will call Lily. Now, Lily came to see me as a college student. She was active in collegiate volleyball and had practices basically year-round. Prior to starting college, Lily had menstrual cycles that were fairly regular. She was not having any significant symptoms and was able to manage her cycles without any additional medical intervention. However, about 5 months after starting college, Lily actually stopped having cycles altogether and became concerned about her overall hormone health. Through some focused lab evaluation, we were able to determine that Lily's cortisol levels were increased, which basically caused her ovulatory function to turn off. Her body was telling her that she was not at a healthy enough stage to be getting pregnant, even though this wasn't her intention at the time. But rather than just trying to focus on forcing the cycles to come back with different hormones, we really targeted correcting the underlying problems by improving and stabilizing Lily's cortisol levels, helping her to have a more healthy exercise routine, and finding ways to manage her stress so that her cycles were able to return regularly on their own over the course of the next few months. So let's talk a little bit more about cortisol. It is one of the most important hormones responsible for helping to manage stress levels, and because of this, it sometimes gets blamed for lots of other problems. However, cortisol is necessary and helps us be able to react in certain situations. For example, if you're out for a walk and a big grizzly bear starts coming your way, you get a spike in cortisol, which allows you to have a rapid increase of adrenaline, which allows you to be able to run more effectively. So acute stressors that happen are a normal part of life, and I don't want you to think that cortisol is all bad. But really where we start to see troubles, especially in regards to your menstrual cycle and fertility concerns, is if you have chronic stress. Now, whether that's a single situation that is long-standing or a series of acute stressors that happens over time, if we see that stress happening chronically, it can increase your cortisol levels, which will impact your menstrual cycles as well. Now, when we talk about stress, a lot of people will think about psychological or emotional stressors. And this can range from things that are going on in your workplace or other significant life events. These may include both positive or negative stressors and can include things like moving to a new home, starting a new job, the birth of a child, a marriage, a divorce, the death of a family member or close friend, or other relationship issues that may create an emotional roller coaster. However, there are also other chronic stressors to be aware of, including anything that impacts your metabolism. So examples of this would include being chronically underweight or chronically overweight, as well as consuming excessive amount of carbohydrates, as these can put significant physical stress on your body when done chronically. The other thing that will increase your cortisol levels are chronic physical stressors, like exercising too much, or constantly fighting off illness or infections. We also consider medical conditions like endocrine disorders, such as diabetes, thyroid dysfunction, or pituitary gland dysfunction, as things that will put chronic stress on the body and negatively impact your cortisol levels. So symptoms that we look for of people that may have high cortisol levels are really vast, but specifically in regards to fertility, we note that high cortisol can cause generalized inflammation in your body. We also find that it can reduce your libido for both men and women, and for men specifically, high cortisol levels have a negative impact on sperm count, motility, and morphology, which is basically how the sperm cells actually look. One of my colleagues likes to say that cortisol is the hormone that can hijack all the other hormones, which is why it plays such a crucial role in evaluation of your menstrual cycles and fertility. It's also important to remember that cortisol levels are going to be variable throughout the day, so you need to know when you are getting them checked and what the ranges are for that time of day for complete evaluation. We know that excessive cortisol levels will decrease gonadotropin-releasing hormone, which in turn decreases your FSH and LH, which are responsible for ovulation. And we'll talk a little bit more about those two particular hormones later in this episode. Excess cortisol levels can also decrease both your progesterone and your estrogen, which we've talked about in the past, as well as blocking follicular development that's responsible for ovulation to occur. During the luteal phase of your cycle after ovulation, we find that an increased cortisol level will actually decrease progesterone and can impair the ability of the corpus luteum to form. And that's really important, especially if we're looking at people trying to get pregnant, because the corpus luteum is responsible for early progesterone production as the placenta is being developed. So, what are some ways that you can improve your cortisol naturally? Again, I recommend trying to focus on correcting the underlying causes with a general healthy lifestyle, regular exercise, but again, not too excessive on the exercise, eating a healthy diet with mindful eating. These are some of the things we focus on to maintain a healthy weight and help eliminate some of the metabolic and physical stresses on your body. The other things that are really important to maintaining an adequate cortisol level include finding ways to regularly connect with other people, taking care of yourself with things like getting more and better sleep, engaging in hobbies or activities, seeking support from others when you need help, as well as setting boundaries, which includes finding ways to say no when your body or brain have been through a lot. I also like to talk about relaxation techniques. Now, whether that's mindfulness, meditation, prayer, yoga, or deep breathing exercises. Some people may need to seek additional formal counseling or therapy support in order to help manage their stress levels as well. I have had clients who say, yeah, I've tried all that and I'm still stressed out. And really the way you can know if your relaxation techniques are effective is that you observe an actual decrease in your heart rate or breathing rate when you're doing these relaxation techniques. If you aren't seeing these changes in your vital signs with your preferred method for relaxation, try something else until you find something that actually works for you. So that's enough about cortisol for now. So let's switch gears and talk a little bit about prolactin. Now, this hormone is primarily responsible for breast development and lactation. Prolactin is produced in your pituitary gland, which is in your brain. And we normally will see prolactin levels elevate if you are breastfeeding or if you are pregnant. Other than that, it's not normal to have an elevated prolactin level. If you are not breastfeeding or pregnant and your levels are elevated, we always evaluate your medications as there are certain prescriptions that will cause prolactin levels to elevate. Depending upon how high your levels are, we sometimes will actually check an MRI scan of your brain. We do this to evaluate for an adenoma on the pituitary gland itself. Now, an adenoma is a microscopic tumor on your pituitary gland, and they are typically benign, but they do secrete prolactin, which elevates the levels in your body, which then blocks ovulation from occurring. This is actually a brilliant design in our body that works naturally if you are breastfeeding. The elevated prolactin levels will try to prevent you from getting pregnant right away again. And that's part of the reason why oftentimes women who are breastfeeding, at least initially, don't go back to ovulating regularly because their prolactin levels are still high. Even if your prolactin levels don't block ovulation, it can make your cycles quite irregular. So even if you're not actively trying to get pregnant, if your prolactin levels are consistently elevated, we do oftentimes prescribe medications to help decrease inappropriate elevation of prolactin levels to get you back to a standpoint of where you are ovulating normally with a normal level of prolactin in your bloodstream. Now, the other hormones I'm going to talk about today go hand in hand. Luteinizing hormone, or LH, and follicle-stimulating hormone, or FSH. Now, I'm going to refer you back to the hormone chart that we have on our website. And again, the URL for this is listed in the show notes for today. What we find with luteinizing hormone is that it's typically fairly stable throughout your menstrual cycle. However, LH levels will spike at the time of ovulation to let us know that the trigger for the developing follicle release has occurred. This LH surge is what helps with transitioning the follicle, which is the capsule around the egg, to open up and release that developing egg. Luteinizing hormone then continues on to help that follicle turn into a corpus luteum, which is responsible for secreting progesterone for early placenta development in case that egg becomes fertilized. Many women will utilize an over-the-counter ovulation kit, which tests for LH to know that ovulation has occurred. Now, something important to know is that with LH test strips, all of them have a different threshold for when they show up positive. Some brands, the LH must be above a certain level to show positive versus negative, while other brands will show either a lighter or a darker strip depending upon the level. For most women, these strips will be positive for at least 24 hours, but some of them can still show positive for even up to 48 or 72 hours. And again, it all depends upon the brand and the sensitivity level of that particular LH level that they're looking at. We could see LH levels being too high in cases of PCOS, or as a woman is approaching menopause, or in women who have ovarian insufficiency or primary ovarian failure. The LH levels will increase in response to anything that causes ovulation to struggle, as LH is trying to stimulate your ovaries for follicular development. On the flip side of things, when we see LH levels being too low, I oftentimes will think back to some of those chronic stressors we had mentioned at the beginning, like excessive cortisol levels, excessive exercise, or eating disorders. Although it's rare, we can also find problems with the hypothalamus or pituitary gland in your brain causing problems with LH levels being too low. Typically in these situations, we see multiple different hormone levels being too low, not just the LH levels. So the other hormone that goes hand in hand with LH is going to be FSH, or follicle-stimulating hormone. And again, referring back to that chart on our website, we see that FSH levels also will spike around the time of ovulation, but to a lesser extent. It's also important to know that we can compare LH to FSH ratios, which can show us how your body is doing as a marker of ovulatory function. Now, it's important to know that we do not want to measure these levels right at the time of ovulation, since the ranges will be far off. If you're looking specifically at the ratios, ideally, I like to check these levels during the luteal phase about a week after ovulation, as they should be approximately equal. For this reason, it's so critical to be charting your cycles so that we are getting labs drawn at the appropriate time in your cycle so that your evaluation is accurate. If I see that an LH level is 2 or 3 times higher than the FSH level, it leads me to question some sort of ovulation dysfunction going on. Now, that could be from PCOS or some other ovulatory defect like ovarian insufficiency or menopause. But we can also see rare cases of FSH being elevated in cases with ovarian tumors or cysts. So it's important to evaluate and have appropriate follow-up. Times where FSH can be too low are situations with chronic stress, again, problems with the hypothalamus or pituitary gland, as well as elevated prolactin levels, which we had talked about earlier, or thyroid dysfunction, which we chatted about last week. With both LH and FSH abnormalities, the most important thing for getting levels back to normal is to treat the underlying cause. In cases where we see that there is an ovulation mismatch, so the LH levels being much higher than the FSH, we oftentimes will utilize a supplement called myo-inositol, which can be used to help with ovulation function. And sometimes we will utilize different ovulation stimulation medications like letrozole or Clomid. But again, we always want to make sure that when we're giving these meds, they're actually helping to improve the outcomes. Because of this, I like to check what's called an ovulation stimulation test, where we check your FSH levels, then we give you medication for 5 days, and then we recheck your FSH levels again. We want to make sure that the amount of medication is appropriate and that it's actually going to make a difference in your ovulation function. Now, the last hormone I want to talk a little bit about today is anti-Mullerian hormone, or AMH. I will sometimes check this level, which can be regarded as a marker of ovarian reserve. Now, it's important to know that this level naturally decreases with age, but it doesn't give an exact time frame of how much longer you are going to be fertile. So, for example, if we find out that your level is 0.9, That doesn't tell me, oh, yeah, you have 3 years left until you can't have babies anymore, or you're 10 years away from menopause. It really just is a general marker that we can watch over time. The one thing we do know about AMH is that your pregnancy rate per cycle will decrease as the AMH level decreases. In general, an AMH level above 1.3 correlates in each cycle of actively trying to achieve pregnancy with an actual pregnancy rate of about 28 to 30%, so roughly 1 in 3. If your AMH levels are significantly elevated, we're talking 8, 9, 10 or above, oftentimes we see that in people that have PCOS. If your level for AMH drops to somewhere between 0.4 to 1.3, we say that the pregnancy rate per cycle is around 10% for each subsequent cycle. And if your AMH levels are less than 0.4, your chance of pregnancy is less than 5% per cycle. Now, again, none of those are zero, but it just helps to show that as the AMH level decreases, so do your chances of pregnancy per each cycle. Depending upon what other hormone abnormalities we may find, in addition to that AMH being low, will help determine the appropriate treatment plan that we utilize for you. Again, this is why it's super important that we're looking at the big picture and that you are never getting just an AMH level checked in isolation. Oftentimes, I will recommend coenzyme Q10 as a supplement at 200 milligrams per day to help with your AMH levels. Beyond that, it really depends on what's going on with the rest of your hormone profile, specifically with DHEA, testosterone, estrogen, and some of the other androgens that we have talked about in past episodes. There are actually some times that we add in either DHEA or testosterone prescription therapy in order to help with your AMH levels and boost them over time. So again, it really just depends upon what the underlying cause is and what other hormonal factors are playing a role. Most importantly, please know that just checking an AMH level in isolation is not a good marker to know whether or not you're going to be able to get pregnant. So don't be overly discouraged if you're told that your levels are too low without having a more comprehensive evaluation. So I know this has been a lot of different hormones here that all play a role with your menstrual cycles and fertility, but they really do all interact with each other. Make sure you tune in next week where we're going to wrap up our All About Hormones series. I'm going to add in a bonus episode where we talk all about blood sugar, insulin, and cholesterol, and why in the world any of that makes a difference with your hormone levels, specifically in regards to menstrual cycle health and fertility, and why it's so important that we evaluate those levels as well. If you're ready to work with our elite team of healthcare professionals, go to our website, radiantclinic.com, to schedule a free discovery call with me and learn more about our package-based pricing for healthcare. We customize your treatment plan and include options to access a hormone coach, fertility awareness charting experts, a registered dietitian, a health coach, and of course, all the medical care you need from me as a board-certified physician. We are currently able to see people for in-person appointments in the Cedar Rapids, Iowa area, or can arrange for a telehealth visit if you live in the state of Iowa. Thank you so much for listening to this episode. Please share this podcast with someone in your life who would benefit from our services. Remember to subscribe to this podcast for more empowering content. I sincerely appreciate your support, and I look forward to sharing more with you on our next episode of Cycle Wisdom.